How you doing?
Yes, sir. How you doing, man?
Good, good. Good to see you, man.
Great to
So,
see you as well. Great to see you as well.
lots to talk about.
In-
Let's talk about the obvious. Let's talk about the hospital or the lack thereof hospital in Brampton. I saw your post that said that you read the budget and there's no actual mention of a real hospital.
Yes, sir. I got the budget right here, and I've been pouring over it for a while now. And there's literally, with respect to Brampton's healthcare, there's no money allocated. There's no timeline given. There's a reference to making an inpatient wing at Peel Memorial, but nothing beyond that. And to me, the fact that the government came out with this huge announcement saying, we're building a hospital when there's no allocation of money, no allocation, no timeline, and beyond anything, no emergency room in a
Sure.
city that has Holly medicine and one hospital for over 600,000 people. It's wrong, and it's unclear, and quite frankly misleading.
So let me ask you this. I mean, I've heard it from the premier's mouth that there's going to be an emergency room, and you're saying there's not. Who's not telling the truth? Like, I mean, like, it,
So let's look at the budget, and I'm holding
okay,
this up for a reason. The budget outlines the government's priorities, where they're spending in this year. This is the
yeah,
2021 budget. Okay.
yeah.
So the premier can say and tweet and say whatever he wants to say. This demonstrates the spending priorities of the government. And I can say, based on the budget, there's not a dollar allocated for Brampton's healthcare. There's not a mention, not a single mention about an emergency room for Peel Memorial. All there is a mention about an inpatient wing, which has no money allocated and no timeline. To me, that doesn't qualify as a huge announcement for a new hospital for Brampton. That's an extension with no timeline and no money given for a part of Peel Memorial. That doesn't meet the standard of what, when we talk about what Brampton needs, Brampton's a city in healthcare crisis. And what
Yeah.
we need, frankly, is we need a independently standalone new hospital. We need to convert Peel Memorial from a health center into a hospital, including an emergency room, and we need to properly fund Brampton Civic. This budget does none of those three.
So let me ask you this: Peel Memorial, is that location the right location for Brampton for a brand new hospital?
We need a separate brand new hospital. Brampton is a city of over 600,000 people, and the NDP's demands have been very clear. Those three things. We need a separate standalone brand new hospital. Peel Memorial does need to be converted into a hospital for sure. We agree with that. But that needs to be something that has dollars allocated to it. It needs an emergency room. And we need to see action immediately. There's no benefit. We've had empty promises from premiers in the past. The Liberals made a very similar, the previous Liberals made a very similar promise in 2017, no action. So we've had enough of these empty promises from Liberals and Conservatives. We need a very clear allocation of money in the budget to ensure that this project actually gets off the ground and our healthcare crisis in Brampton is addressed.
So Premier Ford is in Brampton at 1 p.m. today. What do you think he's going to say?
I'm not here to speculate on what the premier is going to say. I'll tell you what Bramptonians need. And what we need is a commitment, a very clear commitment for 3 hospitals in Brampton with 3 emergency rooms. Right now, we're a city of over 600,000 with 1 hospital, 1 emergency room that is chronically overcrowded and chronically underfunded. We're a ground zero for hallway medicine, meaning thousands of people are treated in the hallways at Brampton Civic because there's not enough space in any rooms. A healthcare emergency was declared in Brampton before COVID-19. We're in a really tough position. And that's why we need the Conservative government to finally act and provide that support and funding to Brampton. That's what we in the NDP are committed to fighting for.
Peel Memorial with the extension, what are they exactly getting?
Right now, based on this budget, we don't know what they're getting.
Okay.
There's one line, literally, there's one line that says inpatient wing, but no timeline, no money, no like. So it's not my job is to look at the facts. Okay, I look at this budget, I see what's given for Brampton. I don't see a dollar at this point. I don't see a single dollar, and this is the government's opportunity. This is their time to say, like, there should be none of this confusion. They could have clearly said in this budget, we are going to be allocating this much money, This is the timeline for it. And then we wouldn't be having this conversation. But the government purposely, because this is a purposeful document. This is not like a note on a side of your table. They spent a long time putting this budget together, and they purposely left out an emergency room. There's not a mention to that at all. There is a mention of an inpatient wing. No money, no timeline. So based on that, I don't feel any confidence to say that Brampton's getting an additional hospital. I don't have any confidence to say that what the upgrades that are happening to Peel Memorial will qualify to the needs of Brampton. And I don't even feel confident to say that what's outlined in this budget is going to happen this year, because the dollars for this year haven't been allocated to the project.
True. Let's talk about sick pay. It doesn't look like it's going to happen. What has to happen in Brampton if sick pay doesn't happen?
So let's look at, first of all, how important sick pay is, and paid sick days is specifically the ask. Just last week, you saw it, we all saw it, this really devastating outbreak of COVID-19 at an Amazon fulfillment center. And we all know Amazon's track record with workers, right? They have a terrible track record with workers, continually being criticized for not giving workers the support they need. Now, this outbreak, it happens in situations, right, when people are forced to make a decision between going to work sick or paying the bills. And Brampton online, we see it all the time. We get dragged a lot in terms of social media. People give us a short end of the stick. And they're very critical of Bramptonians. But when we look at the facts are that workplaces are one of the largest areas of spread for COVID-19. This is directly being said by Dr. Lawrence Lowe, Peel's chief medical officer. That's what folks are saying. So if we want to protect communities, if we want to protect families, if we want to stop the spread of COVID-19 in a community that is one of the hardest hit by COVID-19, we need paid sick days. And without that, we're going to continue to see these outbreaks, because workers are not going to have, you can't force someone to be in that position where they have to choose between going to work sick or paying the bills. That's not a tenable situation. But that's what workers are facing right now. And that's why we need to fight for paid sick days.
But let's just say sick pay is not going to happen. What has to happen in Brampton for it to turn around?
We need paid sick days. We need to keep on fighting. Like this is the facts, and this is not just me. This is public health officials. This is mayors. This is regional health departments. Everyone is saying that paid sick days is one of the most important steps towards fighting COVID-19, for the exact reason that we saw play out live last week, where they're saying literally hundreds of people caught COVID at a fulfillment center in Amazon, at an Amazon fulfillment center in Brampton. And that happens when workers are put in that tough position. So we need to keep on fighting for paid sick days. And that's why we're very dissatisfied with this budget at a time where people are struggling so badly. We're Brampton, right? Like the city that I represent is being hit so badly. We're not getting these basic things that are like scientifically proven. Doctors are supporting it. Healthcare professionals are supporting it. Back to the issue of this budget, just in the hospital, I'll say it's not just me who's saying there's an unspecified amount of money being allocated. It's news articles. Like you go to City TV, Global, CTV, all of them said there's no money, no timeline. So there's all this vagueness. There's no commitment to paid sick days. It's just the government put this budget out that leaves all these questions at a time where people need answers.
I guess what would you do differently if if you guys are in power, you were in charge? How would Brampton look?
So Andrea, our leader, and with the support of Ontarians, hopefully the next premier of Ontario in 2022, she's been very clear on what she would have done. So from the get-go in Brampton, she, along with the support of the Brampton MPPs, we've been fighting to say that Brampton has a healthcare crisis, and we've been left behind for years, literally for years. And we've been underserviced per capita, beds, funding. We're not getting the support we need. And she immediately, and she said this yesterday at the press conference, and she said it continually, she would fight to make sure, and she would invest in Brampton to get the support we need, which means 3 hospitals and 3 emergency rooms. That means immediately funding Brampton Civic, converting Peel Memorial from a health center into a hospital with an ER, and then starting the process of the 3rd hospital, building a 3rd hospital, because that process is a long process. You have to start that now, because we know Brampton's growing in terms of population continually. And if we don't invest now and start that process of a 3rd hospital, we'll be in a situation where we'll have more than 700 or more than 800,000 people and still only 1 hospital. So she's been very clear. She's committed to Brampton. The NDP is committed to Brampton. And we want to see a Brampton that has 3 hospitals and 3 ERs. And we want to see paid sick days for workers across Ontario.
Cool. So we're approaching almost 20 weeks of lockdown in Peel. Do you see it ending anytime soon?
Whenever it comes to issues around lockdowns, I'll always say we have to defer to the public health experts. I'm not a public health expert. I defer to them. They give the guidelines, and we need to support them. And I'm in full support of public health experts. But I will say this: if we want to do lockdowns that really work, you need to do, 2 things. You have to give people the support they need to actually take part in a lockdown, and you have to help businesses get through these lockdowns, small businesses. So I'm in 100% full support of these lockdowns. But if you want to do a real lockdown, that's when you need paid sick days. Because how can you actually do a lockdown when huge amounts of your workforce are still going to work sick because they don't have another option? And then in addition to that, so many small businesses are struggling at this time to no fault of their own. Literally, these are businesses that are functioning really well before COVID-19, but because of COVID-19, they're now struggling. We have an obligation to help them. We have an obligation to support them. And from the province, the Conservative government actually hasn't provided substantial support to small businesses. We've seen a plan come out recently so late into these lockdowns that we're seeing all these issues with people accessing the money, and we're not seeing enough money being given to support these businesses. That's why we in the NDP, from the get-go, we were saying we need a Save Main Street plan where we provide rental support, lease support, where we invest in small businesses to get them through these tough times, where we make sure there's a ban on commercial evictions, where we make sure there's a freeze on utility payments. That's how you help businesses right now. And we've been proposing this since last summer. So, I'm in full support of these lockdowns, but if you want to do a real lockdown, a proper one, you need to give people the support they need to actually partake.
True. Anything else you'd like to bring up, Gurratan?
The big thing that I just want to really focus on is, talking about Brampton's healthcare crisis. That's something that really matters to me. And it's something that, it's important people understand the experience that people have in Brampton, where people in Brampton legitimately have a concern about going to the hospital in their own community. And they fear that based on facts, based on the fact that Brampton Civic was operating at 100% over capacity. When a facility is operating 100% over capacity, naturally you're gonna have these long wait times. You have this hallway medicine. People don't want to go to a hospital and be waiting in a long wait time when they're sick or be treated in the hallway. So they have this issue, and it's a really disheartening feeling to live in a city and be afraid to go to the hospital in your own city. And that's the lived reality of Bramptonians right now. And it's not by surprise. It's when you don't fund a city properly, this is the result. And this is what we've seen happen because of 15 years of neglect or 20 years of neglect of Conservative and Liberal governments. And enough is enough. This is a pandemic. It's demonstrated how bad this and how weak our healthcare system was. The pandemic really brought these issues to the forefront. And the Conservative government, Doug Ford, he had an opportunity to actually address this issue in this budget. He chose not to. And he chose to leave Brampton behind once again. And that's why we in the NDP, if we were in government, we would have been investing from the get-go, not a year before an election in the last budget, putting out these signs for investment. This is something that he could have addressed years ago, but he decided not to. And now at the end, he's putting forth an announcement about it with no details, no timeline, no money. It's not enough.
Well, Gurratan Singh, it's great to finally chat with you on Instagram Live. So, we'll chat again soon. Thank you so much for being here.
Thank you so much, brother. It's a pleasure, and I hope to chat with you again.
Awesome. Take care.
Bye-bye.
Bye.